blurb. Okay. Next thing is you're going to ask for additional resources. You may consider ALS, police, or fire. Next thing you're going to do is consider C-spine, yes, because it's a trauma patient, right? You're going to walk into your patient, you're going to gawk at your patient, look at your patient, and then you're going to have your partner take C-spine stabilization. You need to demonstrate this. So what you're going to say is, so if I had a patient here, I would get on my knees just like this, and I'm going to say, I'm going to have my partner take C-spine stabilization and hold like so. Okay, next thing I'm going to do, just for completeness, because there's going to be no partner there, I'm going to actually reposition myself, and I'm going to go to the side of the patient. So this is the patient's head. I'm going to put one hand on the forehead, one hand on the shoulder, and do what? Are you okay? You all right? Okay. Are you okay? You all right? There's going to be no response. I'm still going to have one hand on the forehead. I'm going to do what next? Pinch the earlobe or pinch the shoulder. Still no response. They are unconscious and unresponsive. Make sense? Next thing I'm going to do is check, right? Looking for normal breathing. There is no normal breathing, right? I will tell you there will be. So there will be normal breathing, but if there was no normal breathing, what should I do next? Call for help, right, or ALS, and then check a pulse. But in this case, they're going to say there is normal breathing. So you're not going to check the pulse right away. You're going to manage what? Airway. So because you're going to manage airway, you're going to go, again, you're going to say, I'm going to have my partner do this, but I'll demonstrate. You're going to go like this, and you're going to do a modified jaw thrust to open the airway. You would suction the airway, right, for any blood, any secretions, okay? And then you're going to insert an oropharyngeal airway, right, and give them a non-rebreather mask of 15 liters. You would look at the chest for any injuries, right? You're looking maybe for any unequal chest rise and fall, right? Asymmetrical movement, anything that you see, maybe bubbles coming out of, right? That's what you're looking for, essentially. If you were to find something, you need to correct for it there, right? If you were to find something, or you could now inspect it further. So I would say that if you find something, if you see something, then what do? Expose the chest and investigate further. Make sense? The chances of you having some sort of injury is high. So let's say, for example, we say there's blood there and there's some bubbling. So what are you going to do?
Occlusive dressing.
It's a sucking chest wound, so what are you going to place?
Occlusive dressing.
Occlusive dressing. Place tape on 3 sides. What if we said that it was asymmetric chest rise and fall, right? And one side was moving, right, independently of the other. What are you going to do? Bulky dressing, place tape on it, or put a cravat around it and tie. Good? You've done B, right? You've done A, you've done B. You're now going to check for C. You're going to check for central and peripheral pulse at the same time, right? They're both going to be present. Next, you're going to check for skin color, temperature, condition, right? And then you're going to check for any gross bleeding. There's going to be no gross bleeding or any gross bleeding, right? You have to manage depending upon how badly it is, or if it's just oozing, you don't care, right? You keep moving. Okay. Next step is what? You need to make a decision. High priority, low priority. High priority patient because they failed any part of the primary survey or initial assessment. Next thing you're going to do is expose the patient and start what? Your rapid trauma assessment. Okay. Rapid trauma assessment, you're looking for DCAP BTLS, which stands for deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, lacerations, and swelling. Start from the top of the head and palpate, right? Go down, right? Check just the face, integrity of the face, the jaw, right? Now you're going to palpate the back of the neck, the front of the neck, looking for any jugular vein distension, tracheal deviation, size and apply a cervical collar. Palpate, right, the scapula, the shoulder, the clavicle, right? Go down the sternum, palpate the ribs, right? If you did have a flail chest or you had a conclusive dressing, you would look at that now, investigate that a little bit further. You would continue down, right? Do one chest excursion, right? Then auscultate, right? Mid-clavicular, mid-axillary. Move down, right? Palpate the abdomen, 4 quadrants. You're looking for distension, right? rebound tenderness or tenderness, any rigidity, any guarding. You go down, right, push in and down on the pelvis. Then you're gonna look at the genitalia for any bleeding, any discharge, right, any loss of bowel, bladder control. Circumferentially palpate down one extremity, right, and again, you should say that you're just looking for decap ETLS. Go all the way down to the end, check for a pulse, right. Do the opposite leg, right, same thing, check for a pulse. Do both legs at the same time. Do the arm closest to you circumferentially, again, looking for decap ETLS, check for a pulse, right. Do the arm opposite of you, right, decap ETLS, check for a pulse. Do both at the same time. Notice I'm not doing CSM. Why? They're unconscious, right? They're unconscious. Okay. Now you're going to take the arm closest to you, put it above the patient's head, right? Take the arm opposite of them, drape it over them, and you're doing a 5-person log roll essentially. One person's going to slide the board, and with the person at the head's command, you log roll your patient, palpate the back, again, looking for decap ETLS, log roll the patient back onto the long board, right, secure them. While you're securing them, right, somebody should try to get a sample history, looking for medical alert tags, right, and then you're going to get baseline set of vitals, respiratory rate, heart rate, blood pressure, skin temperature, condition, right, and now initiate transport. During transport, you're going to have a couple things. Number one, you need to recheck what? Your ABCs, right? Number two, you're going to repeat vitals every 5 minutes, just like you're repeating all these things every 5 minutes. You're rechecking what your interventions were, what you did, your focus, and what you found. You can do a detailed physical exam, now focusing more on the face and taking a little bit more time. And you're going to manage what? Any secondary injuries that you may have found during your rapid trauma assessment that weren't immediate life threats. Questions on these?